Okay, so today we're going to be learning on how to take Invisalign impressions. When we take Invisalign impressions, we're going to be using the VPS putty with the light body. Okay, so you're going to take 1 scoop of each color, kind of fill it up. Doesn't have to be perfect, just about that full size. Then you're going to take both balls and you're going to mix them. You want to make sure that the colors are mixed properly. There's no marble showing, that it's just one solid blue color. So that's what I mean by marble. It's kind of still showing that white. I always tell the patient you're going to feel a lot of pressure when I put this in. This stuff is super, super thick. So we mix, kind of roll it, so you can tell it's still marbly. So you really need to mix it really, really good. Some people tell you that it needs to sit and get really hard. You do not need to do that. You're just getting kind of that mold of the teeth.
How long, like roughly?
You're looking like a good 30 seconds, 15 to 30 seconds in the mouth.
And your mix time's about how long?
Your mix time's probably about a minute.
Okay.
So that is about what you want, a nice solid light blue color. I kind of roll it for the lower a little bit, and then with the tray, I kind of just lay it in there like that, and I use my thumb to kind of press it down into place. Now sometimes you'll get some excess off the back. I'll just pull that off. You want it to kind of wrap around the back like that, and then I'll tell the patient, just gently rest your head back. Breathe through your nose, open nice. You're gonna, don't bite down, relax your lips, and now you're going to press. So then I like to press a little bit, and then in the back, get her lip and everything out of the way, and then down into the front, and then kind of work it, and just kind of let it sit for about 30 seconds at the most. You don't need it to be firm, because you still want you want a little give on the impression material. And then I always check on the patient, how are you doing? Oh. Keep breathing through your nose. I like to make sure that all the gum tissue, the lips, cheeks are out of the way, not getting in the way of the impression material. This part is super easy. The next step is really critical of how your impression is going to come out. Okay, so it's a little firm, but not overly firm. I can still kind of bend this a little bit if I need to. Then I'll come over here, and you're gonna line it with your light body. You always express out some excess. The biggest thing is you're gonna end up using more material than you think you will when you take these impressions. So you can see how I'm kind of going through the teeth. Now, you're gonna let a little bit excess run back, but you're also gonna line the edges back here, or you won't get a good mold of the back molars. A lot of the time that material runs off and it separates from the actual teeth. So you want to get a nice clean look at those back molars. And I put it in, and then I will wiggle the cheeks out of the way and the lips so we get a nice seat. And then you're gonna hold it. This stuff takes about 2 to 3 minutes. So you gotta tell your patients it's runnier, it's gonna go in your throat, kind of breathe through your nose as best as you can. Keep breathing. It makes a little bit of a gooey mess. We'll clean you up as soon as we're done. The biggest thing is you don't take this out too early. You'd rather it sit a little bit longer than too fast, or you're gonna mess up the entire impression. But overusing the light body is the biggest key when you're taking Invisalign impressions, because it will give a really nice clean look at the entire tooth. Most people mess up on Invisalign impressions because they don't use enough of the light body.
How about like when you place the first step, the putty, do you move it around or you just push down and then leave it?
I just push down and leave it.
Okay.
I give a nice good push with the tray. I still wiggle the lips and the cheeks out of the way.
But not the tray with the teeth.
Nope, and I
Okay.
just push it straight down. I kind of use my thumbs to get back there, and I'll push kind of like at an angle on the back of the teeth, so you're getting a nice grip on the back of the teeth, because a lot of people miss the distal portions of the teeth. They don't get that in their impressions. So I like to feel around, and even though it feels hard, I'll still let it sit for another 15 seconds just to make sure underneath it's super hard. So they're super picky about their impressions, so we need to make sure that they're absolutely perfect. There's no smudges or rips or tears. All right, so open big. You're gonna, when you feel that tight suction, you're gonna know that the material is nice and hard, that you've got a nice good mold. And looking at it, you can see how the rings around the back of the teeth, most of the people mess up because of the back of the teeth doesn't have that crisp line. And you can see how beautiful that came out. Like that's a hang on your wall. Yeah.
And that is Invisalign impression training.
Impressions.